The letter arrived at the American Journal of Medical Science in Philadelphia on a Tuesday morning in April of 1847. The editor, Dr. Samuel Morton, opened it expecting another routine submission. What he read instead made his hands tremble so violently that he dropped the pages twice before managing to read them completely. The letter described a dissection, not unusual for a medical journal, but this dissection had been performed by someone who, according to every scientific theory Morton had spent his career proving, should not possess the capacity to understand human anatomy at all. The letter writer, a plantation physician from Virginia named Dr. Elias Cunningham, claimed to have witnessed an enslaved man perform a flawless surgical procedure, explain the function of organs with precision that matched European medical texts, and demonstrate knowledge of anatomical structures that even trained physicians struggled to master. Dr. Morton's response was immediate and decisive. He burned the letter in his fireplace. Then he sat in his study for 3 hours, staring at the flames, knowing that what he had just destroyed represented a threat more dangerous than any abolitionist pamphlet, because if what Dr. Cunningham described was true, then Morton's life work, his collections of skulls, his measurements, his scientific papers proving the intellectual inferiority of African races, all of it collapsed into ash as surely as that letter had. But knowledge once witnessed cannot be unwitnessed, and the truth about what happened in Virginia between 1839 and 1847 would eventually surface, despite every effort to bury it. This is that story. Not the sanitized version, not the comfortable lie. The actual account of how one man's impossible brain broke the scientific establishment, and why that establishment chose to destroy the evidence rather than admit they had been wrong. Before we dive deeper into what made this case so dangerous to the men who built their reputations on racial science, I want to ask you something. How many times have you been told that something was scientifically proven, only to discover later that the science was twisted to support a conclusion people wanted to believe? If you're watching from anywhere in the world where this kind of manipulation still happens, leave a comment telling us where you're from, and hit that subscribe button, because what you're about to discover will change how you think about the relationship between science and power in America. The Henley plantation sat in the Tidewater region of Virginia, where the James River carved through tobacco fields that had made fortunes for 3 generations of the Henley family. By 1839, the plantation operated with the mechanical efficiency of a well-maintained clock. 300 acres under cultivation, 62 enslaved people whose labor generated wealth that allowed the Henley sons to attend medical school in Philadelphia and the Henley daughters to marry into Richmond's finest families. Thomas Henley, the patriarch, prided himself on being a modern planter. He read agricultural journals, implemented crop rotation, and maintained what he considered enlightened management of his enslaved workforce. No whippings without documentation. Medical care provided through a contracted physician. Children kept with their mothers until age 10. He genuinely believed these practices made him humane, never acknowledging that no amount of amelioration could make slavery anything other than what it was. Among the enslaved community on the Henley plantation, there existed a young man named Samuel. The plantation records listed him with unusual detail. Born on the property in 1814, mother died in childbirth with a second child in 1817. Father unknown, though everyone understood that unknown meant one of the Henley men, assigned to house service at age 8, noted as quick to learn tasks, respectful in manner, suitable for skilled work. What the records could not capture was what Samuel carried inside his skull, a mind that operated with a precision and capacity that would have terrified anyone who understood its full extent. From his earliest memories, Samuel experienced the world differently than those around him. He saw patterns where others saw chaos. He understood systems intuitively. He remembered everything with a clarity that felt almost supernatural. When he was 9 years old, Samuel had been present in the main house when Thomas Henley's youngest son, Robert, suffered a riding accident. The boy had been thrown from his horse, landing hard on his left side. The plantation physician, Dr. Nathaniel Webb, was summoned immediately. Samuel had been tasked with fetching water and clean cloths, and in that capacity he observed everything. Dr. Webb examined the boy carefully, pressing along the ribcage, watching for reactions. He explained his findings to Thomas Henley in medical terms, assuming the enslaved child in the corner understood nothing. 3 ribs fractured, likely the 7th, 8th, and 9th on the left side. The pleural membrane may be compromised. We need to monitor for pneumothorax, air in the chest cavity that could collapse the lung. If his breathing becomes labored or he develops fever, we may need to drain fluid. Samuel stood motionless by the door, but his mind had seized on every word. He understood, without being told, that ribs protected the lungs, that broken ribs could puncture the protective membrane, that air or fluid in the wrong place could kill. He visualized the anatomy based on Dr. Webb's description, constructing a mental image of structures he had never seen, but somehow comprehended perfectly. Over the following days, as young Robert recovered, Samuel observed the progression Dr. Webb had predicted. The initial swelling, the careful monitoring of breathing, the gradual healing. And in observing, Samuel began to understand something profound about the human body. It was a system, complex, yes, but governed by rules that could be learned and understood. This awakening to anatomical knowledge might have remained dormant, a curiosity never developed except for a peculiar circumstance. Thomas Henley maintained a library that included his son's medical textbooks from their time at the University of Pennsylvania. These books sat largely untouched, the sons having completed their studies and moved on to other pursuits. But the library needed cleaning, and Samuel had been assigned that task. The first time Samuel opened Gray's Anatomy, he experienced something close to religious revelation. Here, rendered in precise illustrations and detailed text, was the system he had intuited. The skeleton, the muscles, the organs, the circulatory system, the nervous system. Everything explained, everything connected, everything making perfect sense. He began reading in stolen moments, 10 minutes here, 15 minutes there, always careful to return books to their exact positions, always watching for approaching footsteps, always prepared with a cleaning cloth in hand should anyone enter. And what he read, he remembered with total clarity, not just memorized, but understood. He could visualize the structures, understand their functions, see how each system connected to every other system. By age 15, Samuel had absorbed more anatomical knowledge than many practicing physicians possessed. He understood musculature with the precision of a surgeon. He could trace nerve pathways in his mind. He comprehended the cardiovascular system's mechanics with clarity that would have impressed medical professors. And he kept this knowledge absolutely hidden, understanding instinctively that revealing it would bring consequences he could not predict. The plantation had a sick house, a small building where enslaved people too ill to work were kept and treated. Dr. Webb visited weekly, more often if serious illness broke out. Samuel had been assigned to assist in the sick house when he turned 16, a role that put him in direct contact with medical care on a regular basis. Watching Dr. Webb work proved both educational and frustrating. Educational because Samuel could observe diagnosis and treatment in practice, frustrating because he could see mistakes, not terrible errors, but small misunderstandings, outdated techniques, treatments that did more harm than good. Dr. Webb was competent by the standards of 1830, but medical knowledge was advancing rapidly, and Webb had not kept pace with developments. Samuel never corrected him, never questioned, never revealed that he recognized when Webb misdiagnosed a case of pleurisy as simple fever, or when he prescribed mercury for conditions where it would cause more harm than the disease itself. Samuel simply watched, learned, and stored away both correct and incorrect practices, understanding the difference between them with disturbing clarity. The moment that changed everything occurred in July of 1834. Samuel was 20 years old. A field worker named Joshua had been injured during tobacco harvesting, a cutting blade slipping and opening a deep gash across his left forearm. The wound had seemed straightforward at first. Dr. Webb had cleaned it, stitched it closed, and given instructions for keeping it wrapped and clean. But infection had set in. By the third day, Joshua's arm had swollen, red lines radiating from the wound. By the fifth day, he was feverish, delirious. Dr. Webb examined him and delivered his verdict to the overseer with grim certainty. Gangrene. The arm must come off immediately, or the infection will spread and kill him. The amputation was scheduled for the following morning. Joshua would be held down by several men, while Dr. Webb sawed through bone, a procedure that killed patients as often as it saved them. Samuel had helped prepare for amputations before. He knew what would happen. The screaming, the blood loss, the shock that killed men even when the surgery itself succeeded. That night, unable to sleep, Samuel made a decision that would alter multiple lives irrevocably. He left the slave quarters after dark, a violation that risked severe punishment, and made his way to the sick house. Joshua lay on a narrow bed, unconscious, his breathing shallow. Samuel examined the infected arm by candlelight. The wound had been stitched too tightly, preventing drainage. Infection had been trapped beneath the surface, spreading through tissue. But Samuel could see, with the clarity granted by his anatomical knowledge, that the infection had not yet entered the bone. If he reopened the wound, cleaned out the infected tissue, allowed proper drainage, Joshua might heal without amputation. It was insane. He was an enslaved man with no medical training, no official knowledge, no authority. If Joshua died after Samuel intervened, Samuel would be blamed, possibly executed, almost certainly sold away. Everything in his survival instinct screamed to walk away, to let Dr. Webb perform his amputation, to stay invisible. Instead, Samuel sterilized a knife in boiling water. He removed Webb's stitches carefully. He opened the wound wider, cleaned out necrotic tissue, irrigated with alcohol that made the unconscious man groan. He packed the wound with clean cloth, left it open to drain. He elevated the arm to reduce swelling. Then he sat beside Joshua through the night, monitoring his breathing, his pulse, his color. By morning, Joshua's fever had broken. The angry red lines had stopped advancing. The swelling had begun to reduce. When Dr. Webb arrived expecting to perform an amputation, he found Joshua awake, weak but alive, his arm painful but clearly healing. Webb stared at the opened wound with confusion that shifted rapidly through several emotions: surprise, professional curiosity, and then something harder to read. He questioned the overseer. Who had tampered with his patient? Who had removed the stitches? Who had the audacity to interfere with his medical judgment? The overseer had noticed Samuel entering the sick house during the night. Under questioning, Samuel admitted what he had done. But he could not explain how he had known what to do, could not reveal the years of secret study, could not acknowledge the anatomical knowledge that should have been impossible for him to possess. Dr. Webb examined Joshua's wound carefully. The treatment had been correct. More than correct, it had been sophisticated, demonstrating understanding of infection, drainage, tissue viability. Webb had seen trained surgeons make worse decisions. He looked at Samuel with an expression that mixed confusion with something that might have been fear. "What did you do exactly?" Webb asked. Samuel kept his eyes down. "I cleaned the wound, sir. Let it drain. Kept it elevated." "How did you know to do that?" "I watched you work, sir. Tried to remember what you taught us about keeping wounds clean." It was a plausible lie, barely. Dr. Webb accepted it because the alternative, that an enslaved man possessed medical knowledge that rivaled or exceeded his own, was simply too impossible to contemplate. But Webb began watching Samuel more carefully after that, testing him with small questions, asking him to identify instruments, observing his movements in the sick house. Over the following months, Dr. Webb's suspicions grew. Samuel moved too confidently, anticipated needs before being asked, recognized conditions before Webb had completed his examination. It was subtle, easy to dismiss as coincidence or good instinct, but Webb was too experienced to dismiss it entirely. The confrontation came in November. Webb had been treating a woman named Martha for persistent abdominal pain. His diagnosis was hysteria, a common catch-all for women's ailments when doctors could not identify specific causes. He prescribed laudanum and rest. But Martha continued, deteriorating, her pain worsening, her abdomen swelling. Samuel knew what was wrong. The symptoms matched appendicitis, or possibly an ovarian cyst. The diagnosis was crucial because treatment would be different. But he said nothing, knowing any diagnosis from him would be dismissed, or worse, result in punishment for presuming medical knowledge. Martha died 3 days later. The brief autopsy Webb performed revealed a ruptured appendix, infection spreading throughout her abdominal cavity. She might have been saved, possibly, if the diagnosis had been made earlier. Possibly. The surgery would have been dangerous, but she'd had no chance once the appendix burst. After the autopsy, Webb found Samuel in the sick house. The doctor's expression was strange, haunted. He held a medical text in his hands, open to a page about appendicitis. "You knew," Webb said quietly. "When I was treating her for hysteria, you knew what was actually wrong." Samuel said nothing. Silence seemed safest. "How long have you been reading medical texts? How much do you understand?" Still, Samuel remained silent. Dr. Webb made a decision that would set everything else in motion. "I need to test something," he said. "Come to my office tomorrow evening. Tell no one." The testing began that first evening in Dr. Webb's private office, a room attached to his home 3 miles from the Henley plantation. Samuel arrived after dark, moving through shadows, every nerve alert to the danger of what he was doing. An enslaved man, alone, at a white man's home, without permission or witnesses. If anyone saw him, if anyone questioned his presence, there would be no explanation that would save him. Webb's office smelled of leather, tobacco, and something chemical that Samuel recognized as formaldehyde. The doctor sat behind a heavy desk, lamplight casting his face in sharp relief. On the desk lay 3 medical texts, spines facing Samuel. Webb gestured to a chair across from him, a small gesture that violated every social convention. Enslaved people did not sit in the presence of white men, but Webb seemed oblivious to this transgression. His mind focused entirely on the impossible thing he suspected. "Read the spine titles," Webb said. "Cunningham's Manual of Practical Anatomy, Douglason's Medical Dictionary, Cooper's Surgical Essays." Webb opened the Cunningham text to a random page, one showing a detailed illustration of the human heart. He pointed to various structures. "Name these." Samuel hesitated. This was the moment of no return. Once he revealed what he knew, there would be consequences he could not predict. But silence itself was becoming a kind of lie, and something in Webb's expression suggested genuine curiosity rather than entrapment. "The right atrium," Samuel said quietly, pointing. "The right ventricle, the tricuspid valve between them, the pulmonary artery carrying deoxygenated blood to the lungs, the pulmonary veins returning oxygenated blood to the left atrium, the mitral valve, the left ventricle, the aorta carrying oxygenated blood to the body." Webb's hand had begun to shake slightly. "Explain the cardiac cycle." Samuel did, describing the sequence of contractions, the movement of blood through the chambers, the function of each valve, the pressure differentials that drove circulation. He explained it clearly, concisely, with the precision of someone who had not just memorized text, but understood the underlying mechanics completely. The doctor closed the book slowly. His face had gone pale. "How long have you been studying medicine?" 7 years, sir, maybe 8. Since I was assigned to clean the library. And you understand what you've read? This isn't just memorization. I understand it, sir. The body is a system. Once you understand the principles, the details make sense. Dr. Webb stood and walked to his window. staring out into darkness. When he spoke again, his voice carried a strange mixture of wonder and fear. "Do you know what you are, Samuel? Do you understand how impossible you are?" Samuel said nothing. The question had no safe answer. "I have spent years studying medicine," Webb continued. "Years in medical school, years of practice. And you, with no formal training, no instruction, no guidance beyond stolen reading, have achieved a level of understanding that matches or exceeds many physicians I know." He turned back to Samuel. "According to every scientific theory, according to everything we believe about racial capacity, what you have done should be impossible." The silence stretched between them. Finally, Samuel spoke. "Then perhaps the theories are wrong, sir." Webb flinched as if struck. Those words, spoken aloud, represented heresy against the entire scientific establishment. Against men like Samuel Morton, whose skull measurements supposedly proved African intellectual inferiority. Against Louis Agassiz, whose theories of separate racial origins dominated academic discourse. Against Josiah Nott and George Glidden, whose types of mankind claimed to scientifically demonstrate permanent racial hierarchies. "I could report this," Webb said slowly. "I should report this. What you represent, it threatens the entire intellectual foundation of Southern society." "Yes, sir. But if I report it, you'll be sold away. Probably to a cotton or sugar plantation where your knowledge will die with you within a few years. The brutality of those places would destroy both the man and the mind." "Yes, sir." Webb returned to his desk and sat heavily. "I studied under Dr. Morton at the University of Pennsylvania. I have corresponded with the best medical minds in America, and what I have discovered tonight challenges everything they have taught me to believe." He looked directly at Samuel. "I need to understand the full extent of your knowledge, and I need to decide what that understanding means." Over the following weeks, Webb tested Samuel systematically. He presented medical cases, both real and hypothetical, asking for diagnosis and treatment recommendations. He questioned Samuel about anatomy, physiology, pathology, surgery. He presented controversial cases where medical opinion was divided, asking Samuel to evaluate competing approaches. Samuel's performance was consistently remarkable. He diagnosed conditions Webb had initially missed. He suggested treatments more advanced than Webb's usual approaches. He demonstrated understanding of medical principles that went beyond simple book learning to genuine insight. When Webb described a patient with chest pain radiating to the left arm, Samuel immediately identified it as likely angina pectoris, a condition Webb had been treating as indigestion. When Webb mentioned a child with projectile vomiting, Samuel recognized pyloric stenosis before Webb had described the palpable mass in the abdomen. But more unsettling than Samuel's diagnostic accuracy was his ability to reason through novel problems. Webb presented him with a hypothetical case of a man injured in a wagon accident with a compound fracture of the femur, severe bleeding, and signs of internal injury. Samuel walked through the triage decisions methodically. Control bleeding first, tourniquet above the fracture site, assess for hemorrhagic shock, stabilize the fracture to prevent further damage to the femoral artery. Monitor for signs of peritonitis suggesting abdominal injury. He explained the reasoning behind each step, the physiological principles involved, the risks of various interventions. This wasn't memorization. This was genuine medical reasoning, the kind that required understanding cause and effect, weighing risks and benefits, integrating multiple factors into coherent clinical judgment. Dr. Webb found himself in an impossible position. His scientific training told him that what he was witnessing could not be real. The theories he had studied, the measurements he had been taught to trust, all insisted that African-descended people lacked the mental architecture for this level of abstract reasoning. Yet the evidence sat before him, undeniable, making those theories collapse into absurdity. The doctor began bringing Samuel increasingly difficult cases, a presentation on tetanus and its treatment, a discussion of malarial fevers and their various manifestations, a complex surgical case involving a strangulated hernia. Each time, Samuel demonstrated not just knowledge, but judgment, the subtle clinical wisdom that separated competent physicians from excellent ones. In December of 1834, Dr. Webb made a decision that crossed a line from which there could be no return. He began teaching Samuel directly, not just testing what he had learned independently, but actually instructing him in areas where medical knowledge was advancing beyond what the textbooks in the Henley Library contained. They met twice weekly, always after dark, always in secret. Webb taught Samuel about new surgical techniques being developed in Europe, about advances in understanding of infection and contagion, about diagnostic methods that were revolutionizing medicine. He shared his own clinical experience, the lessons learned from success and failure, the nuances that no textbook could fully capture. And, in teaching Samuel, Webb discovered something unexpected. Samuel was not just a passive recipient of knowledge. He asked questions that challenged Webb's understanding. He identified inconsistencies in medical theory that Webb had never noticed. He made connections between disparate areas of medical knowledge that illuminated both. During one session, while discussing theories of disease transmission, Samuel posed a question that stopped Webb cold. If miasmas, bad air, cause diseases like cholera and yellow fever, why do physicians and nurses who treat these patients not fall ill at higher rates than others exposed to the same air? Shouldn't proximity to the sick make medical professionals more vulnerable if air alone carries disease? Webb had no answer. The miasma theory was accepted medical doctrine, but Samuel had identified a logical flaw that observation did not support. Physicians and nurses did sometimes contract diseases from patients, but not at rates the miasma theory would predict. The question suggested something else was at work, something more specific than contaminated air. Years later, when germ theory revolutionized medicine, Webb would remember that conversation and realize that Samuel had intuited the direction medical science would eventually take, simply by observing that accepted theories did not match observed reality. The turning point came in March of 1835. A field worker named Isaac had suffered a terrible accident, his right hand crushed in a tobacco press. By the time he reached the sick house, the damage was catastrophic. Bones shattered, tendons severed, blood vessels destroyed. Dr. Webb examined the injury and delivered his immediate verdict. The hand cannot be saved. We must amputate at the wrist. Samuel stood nearby, observing. He could see what Webb saw, the extensive damage, the destroyed tissue. But he also saw something else. The major blood vessels in the forearm remained intact. The nerves, though damaged, had not been completely severed. If the crushed bones could be removed, if the tendons could be repaired, if the wound could be kept clean, there remained a possibility of preserving at least partial function. It was a desperate possibility. The surgery would be far more complex than a simple amputation. The recovery would be long and painful, with no guarantee of success. But amputation guaranteed disability, while reconstruction offered a chance, however slim, of maintaining some use of the hand. Samuel spoke without thinking. "Dr. Webb, could I speak with you privately?" In the small office adjacent to the sick house, Samuel laid out what he saw. The anatomy that remained salvageable, the surgical approach that might work, the specific techniques for tendon repair, for debridement of crushed bone, for managing infection risk. He spoke quickly, urgently, knowing Isaac lay in agony waiting for Webb's decision. Dr. Webb listened with an expression of growing conflict. "What you're describing, it's theoretically sound, but I've never performed surgery that complex. I'm not certain I have the skill." "Then let me do it," Samuel said. The words emerged before he could stop them. The room went silent. The enormity of what Samuel had suggested hung between them. An enslaved man, performing complex reconstructive surgery, using knowledge he was not supposed to possess, making decisions that could mean the difference between disability and function. Webb's face cycled through emotions too quickly to track. If you fail, Isaac loses the hand anyway. But if you succeed, we face a different problem entirely. How do I explain that an enslaved man performed successful surgery that I could not? Samuel met his eyes directly. Does that matter more than Isaac's hand? The question hung in the air like smoke. Finally, Webb spoke. I'll tell them I supervised, that you assisted under my direct instruction. If questioned, we both maintain that story absolutely. The surgery took 4 hours. Samuel worked with a precision that came from his photographic memory of anatomical illustrations and his understanding of three-dimensional spatial relationships. He removed crushed bone fragments carefully, preserving as much viable tissue as possible. He repaired severed tendons using techniques he had read about but never practiced. He reconstructed the damaged structures in the correct anatomical alignment, fighting fatigue and the weight of responsibility with every suture. Dr. Webb assisted, following Samuel's instructions, handing him instruments, maintaining retraction, and in assisting, Webb observed surgical technique that exceeded his own considerable skill. Samuel's hands moved with confidence and precision. His decisions were immediate and correct. His understanding of anatomical relationships was three-dimensional and perfect. When the surgery concluded, Isaac's hand had been reconstructed rather than removed. The fingers remained, though swollen and damaged. The thumb was intact. The major structures had been preserved. Whether function would return remained uncertain, but the possibility existed. Isaac recovered. Slowly, painfully, but he recovered. 6 weeks after the surgery, he could make a fist. 3 months later, he could grip tools. The hand would never be perfect, never have the strength it once possessed, but it remained functional. Isaac returned to work, able to perform tasks that would have been impossible with only one hand. Dr. Webb watched this recovery with emotions that tore him in multiple directions. Professional pride at a successful outcome. Intellectual excitement at witnessing surgical skill beyond his own, and existential dread at what this success meant for his understanding of racial capacity and human potential. The case became quietly famous within the enslaved community. Samuel, who had saved Joshua's arm, had now saved Isaac's hand. Word spread carefully through the networks enslaved people maintained. When someone fell ill, when someone was injured, they asked for Samuel before they asked for Dr. Webb. They trusted him in ways they could never trust a white physician, and their trust was rewarded with care that exceeded anything they had experienced before. Thomas Henley noticed the shift in how his enslaved workforce viewed Samuel, but he misinterpreted its cause. He believed Samuel had become a skilled assistant to Dr. Webb, useful in managing minor injuries and routine ailments. This seemed entirely appropriate to Henley, evidence of the benevolent system he believed he maintained. A talented enslaved person, given opportunity to develop useful skills under proper white supervision, serving the community in ways that benefited everyone. The reality was far more dangerous. Samuel had become, in practice if not in title, the primary medical provider for the enslaved community on the Henley plantation. Dr. Webb had become his assistant rather than the reverse. And both men understood that this arrangement violated every social, legal, and scientific principle that governed their society. By 1836, Samuel's knowledge had expanded beyond medicine. The Henley Library contained books on natural philosophy, which Samuel recognized as what would later be called physics and chemistry. He read Newton and Lavoisier with the same comprehension he had brought to medical texts. He understood mechanics, optics, the properties of gases. He grasped chemical principles, reactions, the behavior of elements. Dr. Webb, during one of their evening sessions, brought a problem he had been struggling with. He was attempting to improve a formula for chloroform, which was beginning to be used as an anesthetic. The concentrations were difficult to calculate, and Webb's chemistry was weak. Samuel worked through the problem, applying principles of molecular ratios and vapor pressure that he had absorbed from the chemistry texts. Within an hour, he had derived the correct formula, explaining the underlying chemistry clearly enough that Webb understood not just the answer, but the reasoning behind it. This moment, more than any other, crystallized Webb's crisis. Samuel was not just medically knowledgeable, he possessed a mind capable of mastering any intellectual domain it encountered. Mathematics, chemistry, physics, logic, all yielded to his comprehension as readily as anatomy had. The limitations supposedly inherent to his race did not manifest. The inferior mental architecture that science claimed to have proven did not exist in Samuel's case, which meant one of two things. Either Samuel was such an extraordinary anomaly that he represented no challenge to the theories of racial hierarchy, a single impossible exception that proved nothing about the broader population, or the theories themselves were fundamentally, catastrophically wrong. Dr. Webb spent sleepless nights wrestling with this question. He wrote letters to colleagues that he never sent, drafts that tried to explain what he had discovered, while simultaneously defending the scientific framework he had been trained to accept. The letters always collapsed into incoherence, because there was no way to reconcile what he had witnessed with what he had been taught to believe. In June of 1837, a visiting physician from Richmond arrived at the Henley plantation. Dr. Marcus Whitfield was considering purchasing property in the area and wanted to observe local medical practices. Thomas Henley invited him to accompany Dr. Webb on his rounds as a courtesy between gentlemen. During the visit to the sick house, Samuel was present, assisting as usual. Dr. Whitfield observed Samuel handing Webb instruments, preparing medications, changing dressings. The visitor commented on Samuel's apparent competence, praising Henley for maintaining such a well-trained assistant for his physician. But then Whitfield witnessed something that changed the tenor of his visit. An enslaved woman had been brought in with a high fever and severe headache. Dr. Webb examined her, noting the symptoms but seemed uncertain of his diagnosis. Samuel, standing near the examination table, spoke quietly. Dr. Webb, notice the stiffness in her neck when she tries to look down, and the sensitivity to light. Webb immediately understood. Meningitis, possibly bacterial, which would be extremely dangerous. He began the appropriate treatment, while Whitfield watched with growing unease. After the examination concluded and they had left the sick house, Whitfield pulled Webb aside. "That assistant of yours, how much medical knowledge does he actually possess?" Webb felt ice form in his chest. He assists with routine matters. He's observed enough to recognize common conditions. That wasn't observation, Webb. That was diagnosis. He identified symptoms I didn't notice until he pointed them out. And you responded as if his input was clinically valuable. I've trained him in certain diagnostic indicators. It helps me provide better care. Whitfield's expression had hardened. You've trained an enslaved man in medical diagnosis. Do you understand how dangerous that is? Not just to social order, but to your own reputation. If word spreads that you rely on a Negro's medical judgment, your professional credibility will be destroyed. The confrontation marked the end of the relatively safe period Samuel and Webb had been operating in. Whitfield did not report what he had seen, not officially, but he spoke of it privately to colleagues in Richmond. Word began to circulate carefully among Virginia's medical establishment. There was a physician in the Tidewater region who had trained an enslaved assistant to an unusual degree. The reports varied in their details, but the core claim remained consistent. An enslaved man was practicing medicine with disturbing competence. Dr. Webb recognized the danger immediately. He reduced Samuel's visible role in the sick house, instructing him to be less forthcoming with observations, to maintain a more subservient demeanor. But the damage had been done. Samuel's capabilities had been witnessed by someone outside their conspiracy of silence. In September of 1837, Thomas Henley received a letter from the Virginia Medical Society. They were conducting a survey of plantation medical practices and wished to visit the Henley plantation to observe Dr. Webb's work. The letter was professionally courteous, but its intent was clear. They were investigating the rumors about Samuel. The Virginia Medical Society's investigation team arrived on October 15, 1837. 3 physicians, each distinguished in their field, each carrying the weight of scientific authority. Dr. Jonathan Breckinridge from Richmond, who had published extensively on racial anatomy, Dr. Samuel Harrison from Norfolk, who specialized in plantation medicine, and Dr. Charles Pendleton from Williamsburg, who served on the editorial board of the Virginia Medical Journal. They came ostensibly to document best practices in plantation healthcare. In reality, they came to assess whether a threat to the scientific establishment existed on the Henley plantation, and if so, how to neutralize it. Thomas Henley received them with the hospitality expected of Virginia gentry, fine tobacco and French brandy in the parlor. Dinner prepared by his kitchen staff with precision that demonstrated the wealth his plantation generated. Conversation that ranged across politics, agriculture, and the latest European medical developments. The physicians were charming, educated, cultivated. Nothing in their manner suggested the inquisition they intended to conduct. Dr. Webb had been given 3 days' notice of their visit. 3 days to prepare Samuel, to coach him on maintaining appropriate demeanor, to stress the absolute necessity of hiding the full extent of his knowledge. Samuel understood. He had always understood. The performance of ignorance had been his survival strategy since childhood. But 3 years of working openly with Dr. Webb had eroded some of his caution. He had grown accustomed to being respected for his knowledge, to having his insights valued. The mask he had worn so carefully had slipped, and now these men had come to see what lay beneath it. The investigation began the next morning with a tour of the plantation's medical facilities. The sick house was clean, well organized, supplied with instruments and medications that reflected Dr. Webb's competence. The visiting physicians examined everything with careful attention. They noted the surgical instruments, many showing signs of recent use and meticulous care. They observed the organized pharmacy, medications labeled and stored properly. They reviewed Dr. Webb's case notes, which documented his treatments with appropriate detail. Samuel was present during this inspection, standing quietly near the door, performing exactly the role expected of him. Respectful silence, downcast eyes, when addressed. Prompt obedience to any instruction. The physicians barely acknowledged him, which was precisely appropriate to their worldview. An enslaved assistant was furniture, not a person requiring social recognition. But Dr. Breckinridge was more observant than his colleagues. He noticed how Samuel's eyes followed their movements, how his posture shifted subtly when they examined particular instruments, how his expression changed just for a moment when Dr. Harrison made an error in identifying a surgical tool. These were micro-expressions, barely visible, but they suggested an interior life engaged with what was occurring rather than the blank civility one expected from enslaved people. The real test came that afternoon when a field worker was brought to the sick house with a dislocated shoulder. The injury had occurred during tobacco cutting, a sudden fall that had wrenched the joint from its socket. The man was in considerable pain, his right arm hanging at an unnatural angle. Dr. Webb prepared to reduce the dislocation, a straightforward procedure he had performed dozens of times. The visiting physicians observed with professional interest. This was exactly the kind of routine medical care they had come to evaluate. Samuel prepared the necessary materials without being asked. Clean cloths, a wooden bit for the patient to bite down on, a rope for traction if needed. His movements were efficient, anticipating what would be required. Too efficient, perhaps. Too knowledgeable about what the procedure would entail. Dr. Webb positioned the patient carefully, explaining his technique to the visiting physicians as he worked. The standard approach, traction with counter-traction, rotating the humerus externally while applying gentle pressure. He grasped the man's arm, began applying the traction, but his angle was slightly wrong. The shoulder would not reduce, and the patient's pain intensified. Samuel watched for 30 seconds, his face carefully neutral. But as Dr. Webb struggled, Samuel's hands moved almost involuntarily, making a small gesture that showed the correct rotation angle. It was a minute movement, barely noticeable, but Dr. Breckinridge saw it. More tellingly, Dr. Webb saw it and immediately adjusted his technique based on Samuel's wordless correction. The The shoulder reduced with an audible pop, sliding back into its socket. The patient gasped with relief as the acute pain subsided. The room had gone very quiet. Dr. Breckenridge's eyes moved from Samuel to Dr. Webb and back again. That exchange, so brief, had revealed something no amount of careful performance could hide. Samuel knew exactly what Dr. Webb should have done, and Dr. Webb had responded to Samuel's guidance instinctively, without thought. After the patient had been treated and sent back to the quarters with his arm in a sling, the visiting physicians requested a private conversation with Dr. Webb. Samuel was dismissed, but as he left, he caught Dr. Breckenridge's gaze. The physician was looking at him the way a naturalist might examine an unexpected species, with a mixture of scientific curiosity and profound unease. In the plantation house parlor, the conversation began with careful courtesy. Dr. Breckenridge poured brandy for everyone, settling into his chair with the relaxed posture of a man among peers. "Your assistant, Samuel," he began. "How long has he been working in your sick house?" 3 years, Doctor," Webb replied, his voice steady despite the tension he felt. "He's proven quite capable at routine tasks." "More than routine, I think." Dr. Breckenridge took a sip of his brandy. "He anticipated your needs during that procedure, knew which instruments to prepare without being told, and unless I'm mistaken, he corrected your technique. He's observed enough dislocations to recognize the standard approach. Natural mimicry, nothing more." Dr. Harrison leaned forward. "Nathaniel, we've known each other for years. You can be frank with us. How much medical knowledge have you imparted to this man?" "Doctor." Webb faced a decision: lie convincingly or admit enough truth to satisfy their curiosity while protecting Samuel's full capabilities. "I've taught him to recognize common conditions, to assist with basic treatments. It improves efficiency in managing the enslaved population's health." "That's not what we've been hearing." Dr. Pendleton spoke for the first time, his voice carrying an edge. "Word has reached Richmond that you've trained this man to perform diagnoses, that he practices medicine rather than merely assisting with it. Who makes these claims? Does it matter? The claims exist. And what we observe today suggests they have foundation. That Negro knows medicine, Nathaniel. The question is how much, and why you've allowed it." The conversation had reached its crisis point. Dr. Webb could feel the walls closing in, the safe arrangement he and Samuel had maintained collapsing under official scrutiny. "Because I thought knowledge could be contained. I thought if I supervised carefully, if I maintained control, his skills could benefit the plantation without threatening the broader order." Dr. Breckenridge set down his glass with careful deliberation. "That reasoning demonstrates remarkable naivety. Knowledge in the hands of enslaved people is never contained. It spreads, it creates expectations, it challenges the very foundations of the system we depend upon. More importantly, it challenges the scientific principles that justify that system." There it was, the core issue. Not whether Samuel was helpful, not whether his medical care benefited the enslaved community, but whether his existence contradicted theories that underpinned racial slavery. "I want to examine him." Dr. Breckenridge's voice had taken on a harder quality. "Formally, thoroughly. I want to determine the true extent of his knowledge and how he acquired it. This isn't just plantation business anymore, Nathaniel. This touches on questions of scientific importance." Thomas Henley, who had been listening from his chair near the fireplace, finally spoke. "What exactly are you proposing, gentlemen?" "A comprehensive evaluation." Dr. Breckenridge turned to face him. "We question him about medical knowledge. We present him with cases to diagnose. We assess whether his apparent capabilities represent genuine understanding or sophisticated mimicry. The Virginia Medical Society needs to know if this represents an anomaly worthy of documentation or a threat requiring suppression. And if you determine he possesses genuine medical knowledge, then we must ask difficult questions about the scientific theories we've based our understanding of race upon." Breckenridge's expression was grim. "Doctor, Samuel Morton has spent years measuring skulls, documenting anatomical differences between races. His work forms the foundation of our scientific understanding of racial capacity. If one enslaved man can master medicine without formal training, what does that say about Morton's theories? What does it say about all of our assumptions? The room fell silent. They had finally articulated the real danger. Not that Samuel was useful or intelligent, but that his intelligence challenged an entire scientific framework built to justify racial hierarchy. If one enslaved person could demonstrate intellectual capacity equal to educated white men, then the whole structure of supposedly scientific racism collapsed. And if that structure collapsed, what justified the system it was designed to support? The examination was scheduled for 2 days later. Dr. Webb was given time to prepare, but preparation meant something different now. Not coaching Samuel on how to perform ignorance, but warning him that hiding was no longer possible. The truth was about to be exposed, and the consequences would be determined by men who had every incentive to deny what they discovered. The night before the examination, Samuel and Dr. Webb met in the sick house after dark. The doctor looked haggard, aged by the stress of the previous days. "Samuel, I've put you in terrible danger. I should never have begun teaching you openly. I should have maintained the fiction that you were just a capable assistant. Would that have been more honest?" Samuel asked quietly. "Would hiding what I am have changed anything except the timing of this moment? It might have kept you safe." "Safe?" Samuel's voice carried a bitter edge. "I've never been safe. None of us are. We live in a system that treats us as property, and you think performing ignorance makes us safe? It just makes our oppression more comfortable for the people who profit from it." Dr. Webb had no answer to that. The truth of it was too stark, too undeniable. The examination took place in Thomas Henley's library, a room lined with books that Samuel had secretly read over years of stolen learning. The 3 visiting physicians arranged themselves behind a large table, creating a tribunal atmosphere. Dr. Webb stood to one side, officially supervising but effectively powerless. Thomas Henley sat in the corner, present to protect his property interests, but clearly uncomfortable with the entire proceeding. Samuel stood before them, and for the first time in years, he did not lower his eyes. Something had changed in him over the past days. The anger that he had suppressed for so long, the rage at having to hide his mind, at having to pretend stupidity to survive, all of it had crystallized into cold determination. They were going to examine him? Fine. He would show them exactly what they feared. Dr. Breckenridge began with basic questions. Define inflammation. Explain the function of the heart. Describe the major bones of the human skeleton. Samuel answered each question precisely, his responses matching what any medical student would provide. But basic questions were not the real test. Dr. Harrison presented a case study. A patient presents with sudden, severe pain in the right lower abdomen, fever, nausea, and localized tenderness. What is your diagnosis and treatment? Appendicitis. Samuel's response was immediate. Likely acute inflammation, possibly approaching rupture given the severity of symptoms. Treatment requires surgical removal of the appendix before perforation leads to peritonitis. The surgery must be performed quickly but carefully to avoid spreading infection into the abdominal cavity. The physicians exchanged glances. The diagnosis was correct, the reasoning sound, the treatment appropriate. They pressed further with more complex cases. A child with whooping cough, a woman with puerperal fever after childbirth, a man with symptoms suggesting tuberculosis. Each time, Samuel's responses demonstrated not just knowledge, but clinical judgment. Dr. Pendleton changed tactics. Instead of medical questions, he pulled out a text of Latin medical terminology and asked Samuel to translate. Samuel did so fluently. Then Greek, anatomical terms, then French passages from a recent European medical journal. Samuel handled each language with the same facility, his translations accurate, his comprehension obvious. "Where did you learn classical languages?" Pendleton demanded. "The same place I learned anatomy, sir." from books in this library. You're claiming you taught yourself Latin and Greek without instruction, from merely reading texts. Yes, sir. Languages follow patterns. Once you understand the grammar and build vocabulary, reading becomes possible. The simplicity of Samuel's explanation made it sound almost reasonable, as if anyone could master multiple languages through self-directed study. But everyone in the room understood how extraordinary that claim was. Self-taught polyglot ability suggested cognitive capacity that directly contradicted theories of racial intellectual limitation. Dr. Breckenridge pulled out a text that Samuel had never seen, a recently published treatise on surgical techniques from Edinburgh. He opened it to a complex passage describing a new procedure for treating aneurysms. "Read this and explain the surgical approach described." Samuel read the passage once, then explained not just the technique, but its underlying logic, the anatomical challenges it addressed, and potential complications that might arise. His explanation was clearer than the original text, demonstrating not just comprehension, but the ability to synthesize and clarify complex information. The examination continued for 3 hours. Mathematical problems related to medication dosing, chemical formulas for various compounds, questions about pathophysiology, embryology, comparative anatomy. They threw everything they could think of at Samuel, searching desperately for the boundary of his knowledge, the point where mimicry would fail and reveal itself as mere memorization without understanding. They never found that boundary. Every question, no matter how complex or unexpected, met with answers that demonstrated genuine comprehension. Samuel didn't just know facts, he understood principles. He could reason through novel problems. He could explain his thinking. He could identify errors in their questions or challenge assumptions embedded in their premises. Finally, Dr. Breckenridge posed the question that had been implicit throughout the examination. "Samuel, do you understand what you represent? Do you comprehend why your existence is so problematic for men like us? I understand that I contradict theories you need to believe are true." Samuel's voice was steady, but something fierce burned beneath the calm surface. "You've built entire scientific frameworks claiming that people who look like me cannot do what I've just demonstrated I can do. And now you must decide whether to acknowledge that your theories are wrong or to find ways to dismiss me as an anomaly so extreme that I prove nothing." "We're not dismissing you." Dr. Breckenridge's face had gone pale. "We're trying to understand you." "No, sir. You're trying to contain me. You're trying to find a way to explain my existence that doesn't require you to question the foundation of everything you believe about race and human capacity. Because if you admit that I'm not an impossible anomaly, if you acknowledge that I simply demonstrate what many enslaved people could achieve given opportunity, then you must confront the injustice of the system you defend." The room had gone dead silent. Dr. Harrison's hands were shaking. Dr. Pendleton had stood up, his chair scraping loudly against the floor. Thomas Henley looked stricken, as if realizing for the first time that his property possessed not just intelligence, but moral clarity that exposed the violence of the property relation itself. Dr. Webb closed his eyes, knowing that Samuel had just destroyed any possibility of survival. "You could not speak those words to powerful white men in 1837 Virginia and expect to remain unpunished." The truth Samuel had articulated was too dangerous, too devastating to the worldview these men depended upon. Dr. Breckenridge recovered first. His professional demeanor returned, cold and analytical. "Your facility with argument doesn't change certain facts. This examination has revealed something extraordinary, yes, but it has also revealed something dangerous. Knowledge of this nature, in someone of your condition, represents a threat to social order that cannot be permitted to continue unchecked." "What do you propose?" Thomas Henley asked, his voice tight. The physicians conferred briefly in whispers. Then Breckenridge turned back to face them. "This situation requires documentation and careful management. We will report to the Virginia Medical Society." Samuel will need to be relocated where his capabilities can be monitored and where he will have no opportunity to spread his learning to others. You mean sold away? Dr. Webb's voice was hollow. We mean secured. The distinction was cold comfort. Samuel would be removed from the Henley plantation, separated from the community he had served, placed somewhere his knowledge would die with him. If you're intrigued by how power structures work to suppress knowledge that threatens their foundations, make sure you're subscribed to The Sealed Room. We uncover the stories that challenge official narratives and expose the mechanisms of intellectual control. Leave a comment telling us your thoughts on what happened to Samuel. Now let's discover what the scientific establishment decided to do with the man who proved their theories were lies. The formal report submitted to the Virginia Medical Society by Doctors Breckinridge, Harrison, and Pendleton was a masterpiece of evasion and obfuscation. It acknowledged that an enslaved man on the Henley plantation demonstrated unusual facility with medical knowledge, but it carefully avoided stating the true extent of Samuel's capabilities. Instead, the report emphasized the danger of allowing enslaved people access to intellectual domains beyond their station, warned against the risks of such knowledge spreading, and recommended strict protocols for plantation medical care that would prevent similar situations from developing elsewhere. What the report did not include was any acknowledgement that Samuel had challenged the core assumptions of racial science. It did not mention his fluency in multiple languages, his mathematical capabilities, his ability to reason through novel problems with sophistication matching or exceeding educated physicians. It did not document that he had demonstrated every intellectual capacity that scientific racism claimed was impossible for people of African descent. The omission was deliberate. To document Samuel's full capabilities honestly would have required the Virginia Medical Society to confront questions they could not answer without undermining their own authority and the social order that authority supported. So they chose a different path. They acknowledged enough to justify acting, but suppressed enough to avoid forcing the examination of foundational assumptions. The private correspondence between the three examining physicians told a different story. In letters that were sealed and marked confidential, they expressed their genuine shock at what they had witnessed. Dr. Harrison wrote to a colleague in Philadelphia that he had encountered an intelligence that, in any other circumstances, would be considered remarkable. Dr. Pendleton admitted in his diary that the examination had shaken his confidence in theories he had previously defended without hesitation. But Dr. Breckinridge's response was the most revealing. In a letter to Dr. Samuel Morton himself, he described the examination in careful detail, laying out Samuel's demonstrated capabilities honestly. Then he posed a question that cut to the heart of their dilemma. If we acknowledge that this man possesses the intellectual capacity we claim is impossible for his race, we must explain how our measurements and theories failed to predict his existence. Either our science is wrong, or he represents such an extreme outlier that his case proves nothing about the broader population. The first option destroys our scientific authority. The second option feels like intellectual cowardice, choosing comfortable conclusions over uncomfortable truths. Dr. Morton's response came 6 weeks later. His letter was coldly analytical. He acknowledged the challenge Samuel represented, but argued that extraordinary anomalies do not invalidate general principles. Just as human beings occasionally born with 6 fingers do not disprove that humans have 5 fingers, one unusually intelligent Negro does not disprove the general pattern of racial intellectual differences that our measurements have documented. Morton's logic was circular, defining the pattern based on his measurements, then dismissing contrary evidence as anomalous. But it gave Breckinridge the intellectual framework he needed to maintain his beliefs despite encountering evidence that contradicted them. The arrangement for Samuel's relocation was handled with the kind of cold efficiency that characterized business transactions in human property. Thomas Henley, under pressure from the Virginia Medical Society and concerned about his own reputation, agreed to sell Samuel to a buyer who could provide what they called appropriate oversight. The buyer was a physician from South Carolina named Dr. Elias Cunningham, who maintained a small private facility where he conducted medical research. The sale was finalized in December of 1837. Samuel was given no choice, no voice in determining his fate. One morning, he was informed he would be leaving within the week. His mother, whom he had barely known, had died years earlier. He had no wife, no children. The community he had served with his secret medical knowledge could only watch as he was taken away, understanding that his removal was punishment for the crime of being too intelligent, too capable, too dangerous to the lies that white society told itself. Dr. Webb came to say goodbye the night before Samuel's departure. They met in the sick house one final time, surrounded by the instruments and medicines that had been the tools of their collaboration. The doctor's face was haggard with guilt and grief. "I should have protected you better," Webb said. "I should have understood the danger I was putting you in by teaching you openly." Samuel shook his head. "You gave me something no one else could. You treated my mind as worthy of development. You respected my intelligence. That was a gift, even if it's ending like this. It shouldn't end like this. You could have been a physician. In a just world, you would have been educated at the finest medical schools, published research, saved countless lives. Instead, you're being sold to some research facility in South Carolina like a laboratory specimen." The injustice of it hung between them like smoke. Both men understood that Samuel's crime was not ignorance, but its opposite. He had demonstrated that the intellectual limitations supposedly inherent to his race were lies, and for that truth-telling he would be removed from sight, his knowledge buried, his capabilities suppressed. "What will you do?" Samuel asked quietly. "Will you continue practicing medicine as if nothing happened?" Dr. Webb was silent for a long moment. "I don't know if I can. Every time I treat a patient, I'll remember that an enslaved man with no formal education performed surgery I couldn't. Every time I read about racial science, I'll know it's built on foundations of sand. But acknowledging that publicly would destroy my career and change nothing about the system. So perhaps I'll continue practicing and carry the knowledge of my own intellectual cowardice until I die." The honesty of this admission was devastating. Dr. Webb would go on treating patients, teaching students, upholding a medical establishment built partially on lies he now recognized as lies. He would live with the comfort of his position and the corrosion of his conscience. It was a choice, and he knew it was a choice, which made it both more honest and more damning than simple ignorance would have been. Samuel arrived at Dr. Cunningham's facility in rural South Carolina in January of 1838. The place was smaller than he had expected, a converted plantation house with several outbuildings that had been modified for medical purposes. Dr. Cunningham was in his 50s, a man whose medical career had been respectable but never distinguished. He had published a few papers, maintained a small practice, and increasingly focused his energies on what he called anatomical research. The research consisted primarily of dissections. Dr. Cunningham purchased the bodies of enslaved people who died on nearby plantations and occasionally received executed criminals from local authorities. He dissected these bodies carefully, taking measurements, making sketches, collecting specimens preserved in jars of formaldehyde. His goal was to document anatomical differences between races that would provide physical evidence for the intellectual hierarchies that men like Samuel Morton claimed to have proven through skull measurements. Samuel's role in this facility was initially unclear. Dr. Cunningham had been informed only that he was acquiring an enslaved man with unusual medical knowledge who required isolation from the broader enslaved population. For the first weeks, Samuel was simply another worker, assigned to maintain the facility, prepare bodies for dissection, clean instruments. But Dr. Cunningham was observant. He noticed how Samuel moved around the laboratory with familiarity rather than revulsion, how his eyes followed the dissections with professional interest rather than horror. How his hands, when cleaning instruments, demonstrated the careful attention of someone who understood their medical purpose. One evening, as Dr. Cunningham performed a dissection of the human heart, Samuel could not contain himself. Standing at the edge of the room, supposedly cleaning, he watched the doctor struggle to separate the interventricular septum properly. The technique was wrong, risking damage to the structures Cunningham presumably wanted to preserve for examination. "Your angle is too steep," Samuel said quietly. "You're cutting through the septum rather than along it. If you adjust to a more lateral approach, you'll be able to separate the chambers while preserving the valve structures." Dr. Cunningham's head snapped up. His expression moved through surprise to suspicion to curiosity. "Show me what you mean." Samuel approached the table. With Cunningham's reluctant permission, he took the scalpel and demonstrated the proper dissection technique, his hands moving with the confidence of someone who had studied anatomical illustrations until the three-dimensional relationships were burned into his memory. He separated the chambers cleanly, exposing the internal structures without damaging them. Dr. Cunningham stared at the exposed heart, then at Samuel, then back at the heart. "Where did you learn to do that?" "From books, sir, and from observing, and from understanding the logical structure of how bodies are organized." This began a strange period in Samuel's life. Dr. Cunningham, fascinated despite himself, began questioning Samuel about his knowledge. Unlike the Virginia physicians, Cunningham had no investment in suppressing what he discovered. His medical career had been mediocre enough that he had little reputation to protect, and his curiosity outweighed his ideological commitments. Over the following months, Samuel became Cunningham's research assistant, in fact, if not in title. They performed dissections together, they discussed anatomical variations, they debated medical theories, and slowly, despite every social prohibition against it, they developed something approximating a collegial relationship. But this could not last. Dr. Cunningham, eager to advance his own standing, made a catastrophic decision. He began writing about his observations. In letters to colleagues and draft papers intended for medical journals, he described Samuel's capabilities in detail. He documented the dissections Samuel performed, the diagnoses he made, the medical reasoning he demonstrated. Cunningham framed these observations as evidence of his own brilliance in recognizing and documenting such an unusual case, but what he actually documented was proof that racial science was built on fraudulent foundations. In April of 1847, Dr. Cunningham sent his most detailed account to Dr. Samuel Morton at the Philadelphia Medical Journal. The letter described Samuel's capabilities with scientific precision, laying out evidence that an enslaved man possessed medical and anatomical knowledge exceeding many trained physicians. Cunningham requested that Morton publish the findings as a case study in unusual intellectual capacity. Dr. Morton's response was the letter that arrived that Tuesday morning and was burned within hours of being read. What that letter said, we can only infer from Morton's subsequent actions and the fragmentary evidence that survived. But the consequences were immediate and severe. Within 2 weeks, Dr. Cunningham received a visit from 3 men. One was a colleague from the South Carolina Medical Society. One was a representative from Samuel Morton himself. One was a legal agent representing plantation owners in the region who had heard rumors about Cunningham's research. The message they delivered was unambiguous. Publication of findings about Samuel would destroy Cunningham's career, damage the reputation of Southern medicine, and provide dangerous ammunition to abolitionist movements. The research must be terminated, the documentation destroyed, and the subject disposed of quietly. Dr. Cunningham protested initially. This was important scientific work, documentation of an extraordinary case, but the pressure brought to bear was overwhelming. Professional ostracism, threats of legal action, hints of violence. The scientific establishment had decided that Samuel represented too great a threat to be allowed to continue existing as evidence of their fraudulent theories. Samuel himself learned of these discussions through overheard conversations. He understood immediately what was coming. The system had decided he could not be allowed to live as a walking contradiction to their certainties. The only question was how they would accomplish his removal. The solution they settled on was elegant in its simplicity. Dr. Cunningham would sell Samuel to a buyer from the Deep South, someone engaged in the sugar or cotton trades, where life expectancy for enslaved workers rarely exceeded a few years. The brutal labor conditions would solve their problem without requiring explicit action. Samuel would simply disappear into the grinding machinery of plantation agriculture, his knowledge dying with him, his challenge to racial science erased. But before this could be arranged, Samuel made his own decision. He had spent his entire life accommodating a system that demanded he hide his intelligence, to suppress his capabilities, perform inferiority, to make white people comfortable. He had survived by pretending to be what they needed him to be. Now, facing removal to conditions that would kill him within years, he decided that survival was no longer the only value worth prioritizing. On the night of May 7th, 1847, Samuel left detailed documentation of everything he knew. He wrote for 8 hours straight, filling pages with anatomical drawings, medical observations, surgical techniques, diagnostic procedures. He documented not just medical knowledge, but his own intellectual journey, how he had learned, what he had discovered, what conclusions he had reached about the fraudulent nature of racial science. He left these pages in Dr. Cunningham's laboratory where they would be found. Then he walked away from the facility and disappeared into the South Carolina night. What happened to Samuel after that night remains unknown. He vanished from the historical record as completely as if he had never existed. No sale records, no capture notices, no death certificates, simply gone. Some historians have speculated he reached free territory. Others believe he died attempting to escape. Still others think he may have lived out his days under an assumed identity, his remarkable mind hidden once again beneath a performance of ordinariness. We will never know for certain. What we do know is what happened to the documentation he left behind. Dr. Cunningham discovered the pages the next morning. He read them with growing awe and horror, recognizing that Samuel had produced in one night a compendium of medical knowledge and original thinking that rivaled anything Cunningham had seen from trained physicians. And then Dr. Cunningham burned it all, every page, every drawing, every word. He burned the evidence of Samuel's capabilities and his own failure to protect someone whose intelligence he had come to respect. The burning took hours, and Cunningham wept while he did it. Understanding that he was destroying something irreplaceable because preserving it would destroy his own position in a system that could not tolerate the truth Samuel represented. But memory, unlike paper, cannot be completely burned. Dr. Cunningham could not forget what he had witnessed. In his private journals, entries that survived because they were never intended for publication, he wrote about Samuel with a mixture of admiration and grief. He described dissections they had performed together. He documented conversations that had challenged his understanding of human capacity. He admitted, in writing, he never showed anyone that Samuel had been his intellectual superior in every meaningful way. These journal entries were discovered in 1968 during an estate sale after Cunningham's last descendant died. They provided the first solid documentation that Samuel had existed at all, that the rumors whispered about an impossible enslaved physician had basis in fact. Historians began searching for additional evidence, piecing together fragments from medical society records, plantation ledgers, private correspondence. The picture that emerged was incomplete but devastating. Samuel had been real. His capabilities had been documented by multiple credible witnesses, and the scientific establishment of antebellum America had deliberately suppressed evidence of his existence because acknowledging it would have required them to admit their theories were lies built to justify an economic system dependent on human exploitation. Dr. Samuel Morton, whose skull measurements supposedly proved racial intellectual hierarchies, never published anything about Samuel's case. The letter from Dr. Cunningham went into his personal files, and after Morton's death in 1851, those files were curated by colleagues who removed anything controversial. The letter about Samuel disappeared, though references to it in other correspondence prove it existed. The Virginia Medical Society's records from 1837 show unexplained gaps. The official proceedings make no mention of Samuel's examination, though private letters between society members reference it obliquely. Someone, at some point, removed the documentation that would have made Samuel's case part of the historical record. This suppression was not accidental. It was systematic, coordinated, deliberate. Samuel represented proof that the scientific racism undergirding slavery was fraudulent, and that proof had to be erased to maintain the ideological structures that justified enormous wealth extraction through human bondage. But suppression is never complete. Knowledge has a way of surviving attempts to destroy it. The whispered stories in the enslaved community about a man who could heal with impossible skill, the fragmentary journal entries, the gaps in official records that point toward what was removed, all of it bears witness to what the establishment tried to erase. What do we learn from Samuel's story? Not the comfortable lesson that individual brilliance transcends oppression. Samuel's brilliance didn't save him, it destroyed him. What we learn instead is how systems of power respond when confronted with evidence that contradicts their foundational lies. They don't reconsider their assumptions, they suppress the evidence. They eliminate the threat. They protect their authority by erasing challenges to it. The scientific establishment of antebellum America wasn't ignorant. The physicians who examined Samuel weren't stupid. They were intelligent men who chose to defend theories they knew or suspected were wrong because admitting error would have undermined their social position and the economic system they benefited from. That choice, to value their comfort and power over intellectual honesty, is more damning than simple ignorance would have been. Samuel's story also reveals something about the nature of genius under oppression. We will never know how many people of extraordinary capability were destroyed by slavery, their potential extinguished, their contributions to human knowledge lost forever. Samuel is remarkable not because he was unique, but because fragments of his story survived suppression. How many others existed whose brilliance we'll never know about because the documentation was more thoroughly destroyed? The tragedy isn't just Samuel's individual fate, it's the systematic destruction of human potential that slavery represented. Millions of people denied education, denied opportunity, denied the chance to develop and contribute their capabilities. The human cost of that destruction is incalculable, and the scientific fraud that justified it continued long after slavery ended. Racial science, the supposed measurement of intellectual capacity, the hierarchies built on manipulated data and circular reasoning, all of it persisted into the 20th century. Some of its assumptions still lurk in contemporary discourse, disguised with new vocabulary, but serving similar purposes of justifying inequality. Samuel's existence proved that the science was fraudulent. His story demonstrates that the fraud was known by its architects, who chose suppression over acknowledgement. And his disappearance shows how thoroughly systems of power will work to eliminate evidence that challenges their authority. If you've watched this far, you understand why stories like Samuel's matter, not because they're inspirational tales of triumph, but because they reveal how power structures actually function when threatened. They show us that official narratives, scientific consensus, accepted wisdom, all of it can be manufactured to serve interests rather than truth. And they remind us that absence of evidence often means evidence destroyed, not evidence that never existed. The gaps in our historical record aren't accidents, they're erasures. And learning to read those erasures, to understand what the gaps tell us about what was deliberately removed, that's essential to understanding how power maintains itself through controlling knowledge. Samuel's impossible brain threatened an entire structure of scientific racism, so they made him disappear. They burned the documentation, they suppressed the witnesses. They chose comfortable lies over uncomfortable truths, and for more than a century they succeeded in keeping his story buried. But knowledge once created leaves traces, and those of us willing to look at what was hidden, to ask why certain stories were suppressed, to challenge official narratives, we can recover some of what was destroyed. Not completely, never completely, but enough to understand what was taken from us and why. Samuel existed. His mind was real. His capabilities challenged everything antebellum science claimed about race and intelligence. And the fact that his story was deliberately erased tells us everything we need to know about the relationship between power and truth in systems built on exploitation. What other stories have been buried because they contradicted convenient lies? What other evidence has been destroyed because preserving it would have required powerful people to admit they were wrong? These are questions worth asking, because the mechanisms of suppression Samuel experienced didn't end with slavery. They continue in every system where truth threatens power, where evidence contradicts authority, where knowledge challenges the foundations of inequality. If this story changed how you think about the reliability of official narratives and the relationship between science and power, share it with someone who needs to understand how suppression works. Drop a comment telling us what struck you most about Samuel's story. And make sure you're subscribed to The Sealed Room, because we specialize in uncovering the knowledge that power structures tried to bury, the stories they wanted forgotten, the evidence they tried to destroy, the voices they attempted to silence. History isn't just what happened, it's what we're allowed to remember. And sometimes, the most important history is hidden in the gaps, the erasures, the deliberate absences in the official record. Samuel's story was one of those absences. Now you know why it was hidden. And knowing why it was hidden might be the most important lesson of all.